Very good afternoon to all of you. Thanks for joining us here on Mirror Now. I am Afrida Rahman Ali. Today on Big Story, we are going to focus on the COVID surge. Earlier, we were talking about 2 states, Maharashtra and Kerala. Then it went up to 4. Today, we are talking about as many as 8 states that are on the scanner for a rapid surge in the number of COVID cases. But of course, Maharashtra continues to top that list. So that is a state on sharp focus because the kind of increase in percentage that we are seeing in Maharashtra from last week to this week is 81%. And that has really become alarming now for the authorities as well as for the residents of the state. India continues to report the largest surge of COVID-19 cases since November, with, like I said, 8 states now under close scrutiny for this. Over 10,500 new COVID cases and 78 deaths have been reported in the last 24 hours. This is all India figure that we are talking about. And therefore, the question is that why are some states showing a trend which is alarming, showing far higher daily number of cases than others? Maharashtra continues to be the worst affected with 81% surge in cases when compared to previous week. But Madhya Pradesh has now caught up with that figure, and it is also now showing a 43% rise in daily cases. As part of the precautionary measures, Gujarat and Karnataka have reimposed interstate travel curbs to arrest the surge. Health Ministry is focusing on the aspect of trying to figure out if this is a new variant, a mutant strain, which is responsible for the surge. Nearly 900 samples, therefore, have been sent for genome sequencing. The National Institute of Virology in Pune is actively working on it. These are samples mainly from Kerala and Maharashtra. So that study is still underway. My colleague Ayushman is joining me live. Ayushman, you were the one to report about this, that the government is clearly now focused on trying to figure out what particular strain are we dealing with. Tell us more about that, please.
Well, Afrida, in the current context, if you see, both Maharashtra and Kerala remain to be a headache in centers' continuous plan to contain the COVID pandemic. Currently, if you see the status of Kerala and Maharashtra, these both states have been contributing more than 70% of the case load. Now, what the focus is? Currently, we have been told that over 900 samples have been taken from these 2 states, and they will be currently genomically sequenced to know as to which of the variant, if there is any variant that is actually present in the population. Like we know, the UK variant is very easily transmissible. The transmission rate is very high. We also know that the Brazil variant is there in India. The South African variant is there in India. So to ascertain as to which variant is there present in the country right now in Maharashtra and Kerala, if there is something, the clear picture will emerge in about next week, Afrida. But for now, we have been told that active genomic sequencing is being conducted in these 2 states to know whether the mutant strain is also prevailing between the population, whether that is one reason why large number of cases are being reported. Though this is not in isolation with just Maharashtra and Kerala, also Bengaluru and Punjab, they have also sent the sample. Almost 5% of the total positive samples are to be sent for genomic sequencing. But in the current context, if you see, Afrida, definitely Kerala and Maharashtra remain the focus. In the last 24 hours, we have seen 6 states contributing over 80% of active caseload and also mortality. So these 6 states are definitely the headache for the center, and the strategies are being redefined and redesigned so as to how we can actually contain and break the chain of transmission of COVID in these particular states.
Right, absolutely, Ayushman. And therefore, now all energies are focused on this to try and identify the strain. Of course, like you said, the results of the genome sequencing will take about 4 to 5 days more for us to have a precise understanding of this. But net, the issue is, yes, there has been a lowering of the guard. There has been a certain recklessness on the part of the people, on the part of the authorities, on the part of those agencies responsible for maintaining the checks and balances, the civic bodies that are responsible for doing testing and tracing, and of course, also in the vaccination process. Things have not paced up to the extent that we would have liked. And when there is a laxity of this kind, there's a heavy price to pay. and probably we are paying that price. I'm going to introduce my guests this afternoon and our experts who will help us understand the situation. Dr. Shashank Joshi, Dean of the Indian College of Physicians, Lilavati Hospital, joining us. Thank you so much, Dr. Joshi, and welcome. Dr. Rahul Pandit, Director of the Critical Care Fortis Hospital in Mumbai, also with us today. Thanks, Dr. Pandit, for joining us, and welcome to this conversation. I want to begin with you, Dr. Joshi. Now it seems the conversation has got focused on understanding whether this is a new variant. There is a lot of curiosity among people to understand why this sudden surge and why in these specific pockets. What can you share with us as a member of the task force in Maharashtra on the patterns and the trends that you might have observed so far?
I think this trend has been observed for the last 4 weeks. We have been seeing some clusters in Maharashtra, particularly from Vidarbha, as well as the Marathwada region. And a central team was deputed after the Gram Panchayat elections because they saw a surge in Kerala and Maharashtra. And they advised that medical colleges start doing genomic sequencing. And the microbiology department of BJ Medical College last week itself reported 4 strains of E384, which were subject to further analysis to NIV and NCCS, which is a different strain, which is like a African or a UK strain, but probably it's an inborn strain. And they reported one unusual strain like the Andhra Pradesh strain in Yavatmal and one strain from Satara. So I think there is a possibility that the test positivity rate in Amravati region was almost 50% and above. And that rapid transmission probably could be explained by mutant strain. Every virus mutates. So I don't think we should be surprised with a mutant strain or get scared about a mutant strain. Let the scientists do their research and find out what is happening. But the emergent need is to do into public health mode. Now, Maharashtra can be divided into 3 parts. One is this so-called rapid spreading Amravati Vidarbha region. Second is rest of Maharashtra, and third is Mumbai and MMR region. Mumbai and MMR region saw one change. It didn't have elections, but it saw the opening of the locals, which is the lifeline of Mumbai. From 20 lakhs, it went up to 35 lakhs. And Mumbai had a thick tail. Every week, Mumbai was reporting around 350 to 400 cases. They doubled up almost to 800. But I must honestly confess with you, today the numbers are only 600. As of today morning, it is only 600. So Mumbai went into a correction mode. Masking was lapsed. The COVID appropriate measures were lapsed. Community testing had come down drastically. So the state has urgently in the last week ramped up both testing. So as you test more, numbers will go up, but we have to look at the death rates. So death rates have remained flat. So I think that for Mumbai is not a concern. It's still a yellow signal, and I'm not worried about Mumbai. I think Mumbai will get into a correction mode. But if we do get into your responsibility, so now our CM has announced कि me jawabdar means I am responsible. So each citizen should take responsibility on himself, double mask, appropriately behave, and that's the way to go. As far as Amravati Vidarbha is concerned, we need to micro contain them, lock them, and do what has to be done. Rest of Maharashtra is in a mixed state, and that is the cause of worry. The second thing which I want to bring to your notice is last year, exactly at the same time, Mumbai, Maharashtra, and Kerala were the first pockets to start the pandemic. Are we seeing a second wave and its early signals, and then it is spread to the rest of the country? I wish and pray it is not. And this is just an isolated event which we can curb.
Right. Dr. Joshi, you made some important points, but what I find extremely worrisome is what you said about the positivity rate. And you perhaps mentioned that it's gone above 50%. In some areas, which means the transmission is really fast and rapid. If I understand it correctly, it means that if 100 people were tested, 50 have come positive. And therefore, that's the kind of percentage of transmission we are talking about. Dr. Rahul Pandit, how do we break this chain of transmission? If we have the data in front of us now and we know it's happening at a rapid pace, what is the best way to arrest the spread?
So we need to go back to the basics, what we actually implemented in the month of March and April last year. We need to go back to the drawing board. We need to start understanding that this disease spreads because of contact between humans to humans, because when they sort of gather at one place, the transmission happens. So the first and foremost, we need to start increasing our testing. Beyond each positive patient, we need to start testing and isolating 18 to 20 contacts which have basically come in the contact of that positive person, and treat them and isolate them. That's the first step to do. So the government has already started this measure. We are now contact tracing has increased significantly, as well as the isolation of these patients and treatment. The second thing is to actually, as Dr. Doshi said, rightly said, that we need to have micro containment geographic area zones where we can actually put up these Either we call them as a containment zone or we call them a short lockdowns, which is what has happened in the district of Amravati right now. Because we need to bring down this positivity rate quite
Yes.
significantly and very, very quickly. If we don't arrest this rate right now, we will actually be seeing the spread of the disease very fast. Secondly, when we talk about a high test positivity rate, we also need to look at the denominator. So what must have happened in initially phases of Amravati is that maybe 150 or 100 people reported sick, and out of those were the only 100 we were tested, and obviously 50 came positive on that. Now, as the denominator increases, as you start increasing the testing, I think the test positivity rate will start correcting itself to be a realistic one, what we would understand. But there is no doubt that the test positivity rate in Amravati is going to be much higher than Maharashtra, as rest of the Maharashtra and Mumbai. I think these are the two more important things. The third important thing which we need to do is we need to ramp up, and this is my opinion, we need to ramp up the vaccination drive, which is almost running parallel right now, just to the point that we are able to vaccinate rest of the population, especially the ones who are vulnerable, who are above 50 with comorbidity. Now, that government of India is already doing things, but I think we need to be a little
Okay.
bit more rapid in doing that.
Right. Yes, we need to ramp up vaccination. There's, opinion is unanimous in that right now, that the pace is slower than desirable at the moment. I want to also bring our viewers up to speed with some of the measures that have now been taken by states, and I'll go back to the discussion. Even as India witnesses a surge in COVID cases, states have decided to boost certain curbs on interstate travelers to arrest the spread of the infection. At least 4 states have announced new measures. Union territories as well have joined this particular strategy of imposing stronger curbs in interstate travel. Maharashtra, Gujarat, Karnataka and Jammu and Kashmir have made COVID test report mandatory for those arriving from other states, either by rail, road or air. In Gujarat, border checkpoints are being set up for people coming in from Madhya Pradesh and Maharashtra. Remember, these two states right now is showing the highest spike week on week. The percentage in these two states are the highest. So, there is a lot of sort of sense of an alarm now for people coming in from these two states in particular. After Madhya Pradesh, Chhattisgarh has started thermal screening and made it mandatory in airports and Maharashtra borders as well. UP government has made a 14-day home quarantine mandatory for Maharashtra, Kerala and Madhya Pradesh passengers. So, Dr. Shashank Joshi, what we understand here is that now suddenly, of course, the system has woken up to the fact that we are all interconnected, and it is not about one Maharashtra or Madhya Pradesh today, it will be the other states tomorrow. At this juncture, what is your observation on why we have managed to, why these particular regions that have first shown the signs of spike are responsible for such large numbers? Because one has to understand that it's not as if COVID discipline is not maintained in Maharashtra and it's very strictly maintained in UP or Delhi. Generally, the human tendency among Indians, whether it is on attending weddings or say other factors, are usually similar. So why these two states, now it has become more Maharashtra and Madhya Pradesh, you think that, are showing worrisome trends?
So I think the reasons are a couple. Number one is that when the first surge went away, in Maharashtra at least there is a clear trend that there is a homeborn or a inborn mutant. So I think that mutant variant is going to be there, and we are going to get variations. India had 240 variants already, and world has had 5,000 variants of the COVID virus. So obviously the virus will get smarter out of us, because we had also flattened out. If you came here in November, December and January, virtually COVID had gone and most people mentally thought it's gone. Except for the thick tail of Mumbai, which had 350, 400 cases. Across Maharashtra state, virtually the COVID cases were non-existent. That led to a little bit of clandestinity and relaxation, both from administration as well as from people at large. And I think people were not behaving, but community testing came down. Only hospital-based testing was going on. And I think that has led to a surge. So I think there is one finger pointing towards mutant, second finger pointing towards total lack of masking, third finger pointing towards Gram Panchayat elections, which were held probably 4 weeks back. And the fifth finger possibly could be also related to a little bit of a cold wave which suddenly erupted in some parts of these geographies. So all these things put together, I think probably it is a collective thing which probably has done. Virus will mutate. I think that is a given. But the rapid transmissibility will happen. needs to be contained ASAP. And I think we also need to ramp up our vaccination ASAP. But I personally feel that it's a mixture and conglomerate of multiple factors of unmasking, non-appropriate behavior, coupled with possibility of a mutant strain.
Yes. Okay, Dr. Pandit, before I close this conversation, there's a lot of curiosity now, and this is what the common man wants to know, that even if he gets vaccinated, will it protect him from all possible strains? Like Dr. Joshi just mentioned, that there can be so many different strains. So what would you say is, why should people go ahead and take the vaccine, and, will it give them the coverage from all possibilities of various different strains?
So, first of all, as Dr. Doshi already mentioned, mutation is the nature of the virus. And the virus vaccination, the virus producers or the virus company, or the vaccine producers, the vaccine companies, beg your pardon, are actually well versed with this phenomena. And every year, the flu vaccine actually undergoes a correction for the current. The coronavirus will also go it, but you can't expect that to happen in the first or second month of production. Yesterday, I was listening to Dr. Professor Ganga Khedkar on one of the news channels, and I liked his approach that right now we don't even know whether there is a mutant strain or not. And I think it's best leave it to the scientists to work out whether there is a mutant strain or not, and then not actually spread it across, because people will have these questions whether why should I take a vaccine if it is not going to protect me. So I think we should actually be promoting the vaccination and masking, two things which are in our hand right now, to the best of our ability, and leave the scientists to work on what is going to be covered up with which vaccine and not. I think these are the two things which I would like to say. And coming up to the whether to your question, I think most things will be covered, and that correction will happen gradually, and T cell memory will remain.
So very quickly, I would like to mention one point that Covaxin actually can handle mutants very well. So can Covishield, maybe exception of a little less efficacy for South African. So currently our vaccinations, both the vaccines which are available through the government of India, have an ability to handle mutants. So therefore it's urgently required to ramp up the vaccination drive.
All right, those are very important points, and I hope our viewers would pay heed to the fact that, yes, let the scientists do the job of understanding the genome sequencing, etc. Our job as citizens is to go ahead and take the vaccine when our turn comes, and also, of course, follow COVID-appropriate behavior. There can be no more taking chances with the virus. Thanks very much, Dr. Joshi and Dr. Pandit, for joining us this afternoon. Well, of course, there are now several new measures announced by the government, and clearly tightening the process of controlling the virus. But important part, of course, right now is that new norms are being announced by several states, and particularly quarantine norms. In Mumbai, for example, a quarantine for passengers coming in from certain countries, from Brazil, for instance, the compulsory quarantine that has been announced.